Dwight Owens, and what do you say to that, Dr. Owens?
I was listening attentively to that response, and I just wanted to make it perfectly clear that depression is a medical illness, and as with hypertension, diabetes, or cancer, before you even begin to develop a treatment plan, the patient needs to see a physician. There are pastors, there are therapists, but it's very important to be sure that if you have the disease of clinical depression, you see a physician.
So let me ask you this: why don't black men get treated? Why don't they take the medication? What's up with the medication?
Well, I think one problem with medication is that a lot of the majority physicians or physicians that are not of color don't understand dosing strategies with African Americans. We actually are what you call slow metabolizers.
Okay.
And being a slow metabolizer would mean that we would need smaller dosages of some of the medications used to treat depression, for example, whereas a white male may need 20 milligrams of Prozac, a African American may need only 10 milligrams of Prozac. And when you dose an African American with higher milligrams of the medication, they are prone to more side effects. And once you've had an adverse outcome secondary to the side effect of a medication, issues with compliance come in. You don't want to take the medication, you stop taking the medication. So it's very important for African Americans, in particular men, to see providers, physicians, clinicians that have a cross-cultural component to their training.
So in taking the medication, it is important then to go through the whole process. Don't start and then stop. Is that what you're saying?
It's very important. The first thing you should do is see a physician.
Mm-hmm.
I understand pastoral counseling.
Yeah.
I understand therapists. I myself am an ordained elder. But it's very important to go see the physician. Why? Because depression can look like it's something that just needs therapeutic intervention. But oftentimes, like diseases like pancreatic carcinoma can present as depression. Hypothyroidism can present as depression, and a therapist or a non-physician trained therapist is not going to know what the workup should include at the initial onset of this particular disease.
How about that? When we come back, we'll continue our conversation with Dr. Dwight Owens on how and why are black men depressed on Praise 102.5.